Good afternoon, Peter Goertz. I'm a psychiatrist. How do we balance quality and quantity as a doctor? So can you see 100 patients per day and still do good work and still enjoy yourself and still do safe work? Each of us, I think, probably has to decide for ourselves. So what brought me to think of this is I saw a patient yesterday, and this patient was an older lady, and she'd been acting quite strangely for the past day or so, and we didn't really understand why. She was a lady in an emergency room. I was asked to see her virtually, and she was, when I tried to talk with her, she was quite well oriented, but acting very strangely. And I did not understand what was going on. And I reviewed the chart medically, psychiatrically, and I really still didn't understand what was going on. Some of the lab work wasn't back yet. The result of the CAT scan of the head wasn't back yet. But my point with all this is I spent a good amount of time trying to figure out what was going on. And I tried to reach family. The patient was agreeable to me calling her family. So I tried to reach the family, and I reached a sister, and the sister couldn't tell me much. And I many times tried to reach the husband with whom the patient lives, and I was not able to reach the husband. So I was just sitting there not really knowing what was going on. Time was passing by. Altogether, I ended up seeing this patient for about an hour and a half, which is a lot of time. And that's where the issues come in, difficult issues for doctors, because we need to, in order for our supervisors to feel good about our work, we need to see a certain amount of patients. We call that RVUs. We need to do a certain amount of billing encounters. And if you see each patient, each consultation for an hour and a half, then you don't see that many patients during the day. So it's a balance, and it can be a difficult balance to strike. So ultimately, in this situation, I was able to reach the husband, and he said, "Oh, it's very simple. Whenever she runs out of her Lyrica, which is pregabalin is the generic term, she starts getting confused, acting strangely, and that's what happened." So I had time actually yesterday, so I did have time to work on this patient. But if I'd not had time, I probably would have not called that husband as many times as I did. And finally, I was able to reach him after maybe about half an hour. And I don't know the follow-up, but he may have solved the whole situation by just telling me simply, again, whenever my wife runs out of her Lyrica, she gets confused, starts acting strange. And that was basically the story. And she apparently her behavior can become troublesome when she does not take the Lyrica, when she abruptly stops it. And I checked what we call the prescription monitoring program website, and she'd been prescribed a certain amount of Lyrica and had already run out. So it seems like she may well have been taking more than prescribed of the Lyrica. So that's another aspect, but that also takes time again to check that prescription monitoring website. So again, this particular situation worked out well. I hope, again, I don't have follow-up, so I did write in my evaluation what I thought was going on and recommendations regarding possibly restarting Lyrica to hopefully get the patient back to a stable state of mind. And apparently, I did not know this. This was my first encounter with Lyrica withdrawal. I did not know that it can be quite troublesome, and I think even potentially dangerous. Maybe people could even have seizures, which would be understandable. So things take time, often good things take time, as people have said for many years. And each of us needs to balance how much time we want to take with an individual patient. And this can be tricky because we want to do a good job. We want to also see enough patients. There may be patients waiting. So fortunately, in this situation, it worked out well. But it's a balance that I encounter pretty much every day and that I need to work on striking the right balance for me and the patients every day. And bottom line, I also want to enjoy my work. So that was what happened yesterday. Thank you.